Hello and welcome to the Oakland County Medical Control Authority Stroke Special Study Hospital Training Module. This education is designed for hospital personnel participating in the OCMCA Stroke Special Study. The purpose of this study is to determine if EMS personnel can identify patients that are candidates for endovascular therapy with a reasonable degree of accuracy, utilizing a pre-hospital stroke severity scale. This special study is scheduled to begin January 1, 2018. This brief education module will provide emergency department physicians, neurophysicians, nurses, techs, and other applicable staff with an overview of the OCMCA Stroke Special Study, an overview of large vessel occlusion stroke, an introduction to the FAST-ED Stroke Severity Scale, which EMS will utilize to measure stroke severity in the field, details regarding the vital patient information that EMS will communicate to the ED during a stroke alert when transporting a stroke patient, and finally, details regarding the EMS documentation that ED staff should expect to receive from the Bloomfield Township Fire Department, which is currently the only life support agency participating in this study. 2 OCMCA hospitals have volunteered to participate in this special study: Beaumont Hospital, Royal Oak, and St. Joseph Mercy Oakland Hospital. As stated earlier, the only LSA currently participating in the study is the Bloomfield Township Fire Department. All paramedics at the Bloomfield Township Fire Department have received in-depth lecture and hands-on training for the study. The EMS training was designed to improve pre-hospital stroke recognition, treatment, and transport, as well as strengthen the EMS provider's understanding of various stroke syndromes, stroke mimics, and best practices in stroke care with an emphasis on pre-hospital recognition of large vessel occlusion strokes. To support pre-hospital stroke recognition, the Bloomfield Township Fire Department paramedics received detailed training on the FAST-ED Stroke Severity Scale, which will be introduced later in this course. LVO is a common kind of ischemic stroke that affects any of the proximal blood vessels of the brain, including the internal carotid arteries, the middle cerebral arteries, and/or the basilar arteries. The obstruction of cerebral blood flow in the presence of LVO is more severe due to the involvement of large cerebral arteries. Greater declines in cerebral blood flow correlate with more extensive regions of ischemia and increased core infarct size. As a result, LVOs are associated with much greater likelihood of death and severe disability when compared to small vessel strokes, which affect smaller arteries and in turn impact smaller regions of the brain. Patients suffering from an LVO stroke are candidates for EVT. Remember, the purpose of this study is to determine if EMS personnel can identify patients that are candidates for EVT with a reasonable degree of accuracy, utilizing the FAST-ED Stroke Severity Scale. Over the past year, the OCMCA reviewed compelling data that supports the potential positive impact of pre-hospital identification of LVO strokes by EMS. Currently, there are a handful of validated stroke severity scales being utilized throughout the United States. FAST-ED was selected by the OCMCA Stroke Subcommittee, which was composed of subject matter experts. This decision was based on evidence that supports FAST-ED's superior ability to detect LVO strokes when compared to other stroke severity-based scales. FAST-ED stands for Field Assessment Stroke Triage for Emergency Destination. This pre-hospital stroke severity scale is based on components of the NIH stroke scale. In fact, it has been shown to be comparable to the full NIH stroke scale for identifying LVO patients, but is significantly less time-consuming and easier to use, which makes it better suited for the pre-hospital environment. The FAST-ED acronym can also be used to assist EMS providers in recalling all of the assessment criteria associated with the scale. In this context, FAST-ED stands for facial palsy, arm weakness, speech changes, time, eye deviation, and denial, neglect. Each time the Bloomfield Township Fire Department encounters a patient presenting with an acute onset neurological complaint, they will screen the patient for stroke utilizing FAST-ED. If signs and symptoms of stroke are present, they will be scored based on the type and severity of the deficits noted. After the assessment is complete, the paramedics will calculate the total FAST-ED score. The use of FAST-ED produces a total score from 0 to 9. A FAST-ED score of 4 or greater indicates a high probability of LVO stroke. It is important to understand that a FAST-ED score of 0 does not mean that the patient is negative for stroke signs and symptoms. An acute onset of ataxia, slurred speech, and/or visual field deficits are all signs and symptoms of a stroke that are not given a score by FAST-ED. With this in mind, if Bloomfield Township Fire Department personnel cannot attribute neurodeficits such as these to another cause, it will likely lead to a stroke alert notification to the receiving stroke center, but the FAST-ED score will be 0. It is important to understand that the FAST-ED score indicates the stroke severity. In contrast, a stroke alert called in by EMS indicates that signs and symptoms of a stroke are present. Bloomfield Township Fire Department personnel have been instructed that there are 3 key checkpoints for communication with the receiving stroke center. The first is the pre-hospital stroke alert notification. The second is the face-to-face transfer of patient care at the hospital. And finally, the information contained in their patient care report, or PCR, is the last communication checkpoint. As stated earlier, Bloomfield Township Fire Department paramedics will provide a stroke alert by radio or phone to the receiving ED each time they encounter a stroke patient in the field. Bloomfield Township Fire paramedics have been trained to include the following information in their stroke alert: the FAST-ED score, a list of neurodeficits identified during their patient assessment, the patient's last known well date and time, the date and time of sign or symptom discovery, if the patient takes blood thinner medications, as well as the name of the medication and the date and time of their last dose, relevant vital signs, and finally, the estimated time of arrival. Again, a FAST-ED score of 0 does not mean that the patient is negative for stroke signs and symptoms. Remember, the FAST-ED score indicates stroke severity. In contrast, the stroke alert called in by EMS indicates that signs and symptoms of a stroke are present. Please note that Bloomfield Township Fire Department personnel have been instructed to provide the receiving stroke center with 2 sets of times. The first is the patient's last known well time, which is the date and time the patient was last known to be without signs and symptoms of a stroke. The second is the date and time of sign or symptom discovery, which is when the signs or symptoms of the stroke were first discovered. Bloomfield Township Fire Department personnel have been instructed that a last known well time of 24 hours or less indicates priority 1 transport of a stroke patient to the closest stroke center. In addition, the paramedics have been instructed to attempt to rule out common stroke mimics prior to establishing a differential diagnosis of stroke. Pertinent negatives for stroke mimics should be provided to the receiving stroke center by the paramedic during the stroke alert notification. If not provided, that information should be made available upon request by the receiving stroke center. Bloomfield Township Fire personnel have also been trained to provide the following core information to the ED staff during the face-to-face transfer of patient care: a FAST-ED score, a list of neurodeficits identified during the patient assessment, the patient's last known well date and time, the date and time of sign or symptom discovery, if the patient takes blood thinner medications, as well as the name of the medication and the date and time of their last dose, relevant vital signs, and finally, the name and phone number of the patient's next of kin. As you are probably aware, the availability of this information is vital to optimal stroke patient treatment in the hospital. In an effort to facilitate and improve the delivery of this information to the ED staff, the OCMCA FAST-ED Stroke Severity Scale scoring checklist has been developed. This paper document will assist EMS with assessing and scoring each component of FAST-ED. In addition, this document is meant to facilitate the collection and communication of other vital information related to the stroke patient's history and current condition. Bloomfield Township Fire Department paramedics have been trained to complete and provide the form to the nurse or physician accepting care of the patient during the face-to-face transfer of patient care. This form is intended to serve as a resource to the ED staff and neurointerventionalists as they decide the stroke patient's treatment plan. We recommend that you pause the training video now so that you can obtain a copy of this form prior to completing this part of the training. This will allow you to familiarize yourself with the document as you follow along. Your hospital's stroke coordinator has been provided access to the form by the OCMCA. At the top of the form, you will note a field that contains the patient's name and date of birth. The patient's last known well and symptom discovery date and times are also found at the top of the form. The FAST-ED assessment steps and their associated scores are found in the middle of the form and are self-explanatory. Please note that dysarthria is a sign of stroke that is not scored by FAST-ED. However, assessment for dysarthria does require a yes or no answer from EMS. You'll find the total score at the bottom of the FAST-ED assessment section. The next field on the form notes if the patient has a previous history of stroke. Moving down the form, you'll note a field that documents anticoagulant use and the date and time of the patient's last dose when applicable. Next of kin information is located towards the bottom of the form. A space to record vital signs is located near the bottom right corner of the form. Space for additional EMS notes is located along the right side of the form. Finally, at the very bottom of the form, you will note a perforated tab with patient information, which includes the patient's name, date of birth, and home address. This is designed to allow for expedited registration of the stroke patient upon arrival at the hospital so they can be immediately taken to CT as quickly as possible when directed by hospital staff. Bloomfield Township Fire Department personnel have been trained to document this patient information, then tear off the perforated section and hand it directly to the hospital's registration personnel. The final checkpoint for communication is the Patient Care Report, or PCR, which is an important resource for the stroke team as they consider treatment options for the stroke patient. Bloomfield Township Fire Department personnel have been encouraged to assure that the PCR is immediately available to the hospital prior to departing, although this may not always be possible. Remember, the OCMCA Stroke Special Study begins January 1, 2018. Once the study begins, the Bloomfield Township Fire Department will begin reporting FAST-ED scores during their stroke alert notification to the receiving stroke centers. The Bloomfield Township Fire Department is required to formally notify the OCMCA of any patients transported with a differential diagnosis of stroke. The receiving stroke hospital stroke coordinator or designee will then be required to formally submit specific procedural and outcome data to the OCMCA. Finally, the OCMCA will perform an ongoing analysis of all pre-hospital and hospital data in order to monitor the accuracy of EMS identification of LVO stroke patients with the use of FAST-ED. This concludes our presentation of the OCMCA Stroke Special Study Hospital Training Module. The OCMCA is excited to partner with the Bloomfield Township Fire Department, St. Joseph Mercy Oakland Hospital, and Beaumont Hospital Royal Oak to evaluate, improve, and innovate stroke patient care within our system. Please contact the OCMCA by email at qi@ocmca.org with any questions regarding this training module. Have a great day.